So who is getting tested for COVID-19?
Unfortunately, right now, most places in America do not have enough testing supplies to test everyone, even everyone who has symptoms of COVID-19. So many people aren't being tested even when we would love to test them. You cannot currently get tested at home. You need to go to a hospital or a healthcare clinic to get tested. Testing does not depend on your health insurance status. Testing depends on meeting a certain set of criteria. This is changing so frequently that you will have to recheck probably every day, every week to find out what the current testing criteria is. Some people who might get a test are as follows. People who are over the age of 60. People who are under the age of 60 but have diseases that might affect their immune system or might be less able to fight off a viral infection. People who are admitted to the hospital, including pregnant women, and people who are about to have surgery. Other people who should get tested, who will get tested, are people who work in healthcare, people who work in meat packing, and other people who have been deemed essential employees, people who are essential to making our society function. Even if we can't test everyone, we should treat everyone who has symptoms as if they have COVID-19, because they are very likely to be infected, even if we can't prove it with a test. If you have symptoms severe enough to be kept in the hospital, you'll probably be tested. But to find out more about whether or not you currently qualify to be tested for COVID-19, go to testiowa.com. Diagnosed with COVID-19 on a COVID-19 test. Why am I being sent home and not being asked to come into the hospital?
This is a good question again. There is no medicine currently to treat COVID-19. The only people who are being admitted to the hospital are people who are extremely sick. In the hospital, patients might get fluid in their vein or intravenous fluid, extra oxygen, or even a ventilator to help them breathe. If you're sent home, it's not discrimination. Almost everyone is sent home. Even people who have good health insurance and can pay for the hospitalization are not being brought into the hospital unless they need help breathing. Most people are going to get better on their own at home. If you have a positive test for COVID-19 and you are sent home, the doctors will give you a device called a pulse oximeter. This helps you monitor your oxygen level. If you have low oxygen, you'll be told then to return to the hospital. Many people are afraid of public shaming once people know they have COVID-19. What is being done to protect patients' identity?
If you get sick and test positive for COVID-19, please do not feel like you have done anything wrong. The virus is affecting people all over the world. We're seeing community-wide spread in Johnson County and many places in Iowa, which means that anyone is likely to be infected and anyone is likely to test positive. Your local health department is informed when county residents are in Iowa test positive for COVID-19. They will contact you at the telephone number that you gave to your healthcare provider where you were tested. When they call to follow up with you, the number may show up as unidentified. Please pick up. If you test positive, be sure to answer the phone so you can receive the help that you need. Your local health department treats the information that they get from the hospital and healthcare providers with confidentiality. This is private, confidential health information, and they are calling you to help you and to help other people in your community. Are the tests being given to employees at Tyson and other meatpacking plants the real COVID-19 tests?
Yes, those tests at Tyson and the other meatpacking plants throughout Iowa and the rest of the nation are real tests. There's a special program right now from the state that offers tests wherever there is an outbreak, like what happened at Tyson. These may also be available where there are other outbreaks like retirement homes or nursing homes, but these are definitely real tests helping to control the outbreak.